Okay.
And also, it's my pleasure to present next speaker, Valentyna Sharandak, the authorized representative of the WOAH Capacity Building Department. And the microphone is yours, dear Valentyna.
First of all, I would like to congratulate people who organize this event, my friends, my colleagues. I know Maria for a long time. I think maybe all my life we know each other. And Marina and Valeria, thank you so much. It's really a pleasure to be here today. I hope you can see my presentation. It's okay?
Yes.
Okay,
yes.
Great. So I will not speak a lot, but
Valentyna, I'm sorry, we can see it, but if you can turn to the presenter's mode, it would
Does
be...
it work?
Yes,
okay.
Perfect,
Yeah,
thank you.
It was my question, great. Okay, so I will speak very briefly. My your previous speaker didn't cover some aspects, so I will go a little bit to details. So I would like to speak about One Health Joint Plan of Action. On 17 October 22, One Health Joint Plan of Action was launched. Now we call it by quadripartite organization or structure. It's FAO, UNEP, World Organization for World Organization, and WOAH. Now we are not OAE anymore, not MAP in Russian, Ukrainian. We are WOAH. In Spanish, it's OMSA. In French, it's OMSA. Or WOZIT in Ukrainian. Just small comment. One Health Joint Plan of Action is the first plan. The purpose of this plan was to create a special framework to integrate systems and capacity that we can collectively prevent, detect, response to the health threats. One Health Plan was developed like participatory process. So all parts were participated in this approach, and they provided set of activities with the purpose to strengthen collaboration, communication, capacity building, and coordination across all sectors that are responsible for animal plan environment interface. As the previous speaker was speaking about 5-year plan, so I would like to just highlight that we have this 5-year plan is focusing on 6 areas. It's One Health capacities for health system, emerging and re-emerging zoonotic epidemics, endemic zoonotic, neglected tropical and vector-borne disease, food safety risks, and antimicrobial resistance and environment. Of course, we call sometimes like action tracks. It can be different titles, but the main ideas reflected in these 6 areas. So this plan sets specific objectives to provide really the main idea and the main objective is collaboration and cooperation between all sectors. And it brings and highlights importance of cooperation and shared responsibilities, multi-sectoral actions and partnership between all sectors. So it was briefly, I just would like to highlight what WOAH is doing in this field. So at the beginning of this year, because it's still in the document, we can see OAE, it was made special WOAH resolution where we created kind of Friends of One Health group. Actually, this resolution was was highlighting specific activities of member countries. As you know, members WOAH delegates, usually it's a chief veterinary officer who presents country. It's a representative from the veterinary service. Very often it's in different countries, it's different ministries. In some countries, it can be Ministry of Health. In some countries, it's Ministry of Environment or Ministry of Agriculture. Very often it can be separate structure like food agency or kind of what we have in Ukraine. So also WOAH developed specific message, key message to all our delegates, where they highlighted importance to cooperate and to work together as in charge of cooperation, like to bring attention to Ministry of Foreign Affairs, Finance, Ministry of Agriculture, Environment, or Wildlife. So it was specific message. It was delivered to our members in summer, I think. So they highlighted this importance, and we received positive feedback from our member countries. As already was mentioned also in previous presentations by Dr. Sol Perez and also by Olena Kuriata, they were speaking about PVS pathway, where we have reflected One Health activity. So this is famous cycle that provides 4 stages for orientation, evaluation, planning, where we identify gaps, and costing tool, and targeted support. So I would like to highlight this targeted support, where we have One Health integration. And as Olena was speaking about national bridging workshops. Actually, I'm presenting department capacity building, where we are working in PVS secretariat. We're responsible for all PVS missions, where we evaluate activity of the veterinary service of the country, including One Health. So national bridging workshops we already implemented in different countries in the world. We implemented around 60 national bridging workshops, where we bring together veterinarians, public health, environment, wildlife, all people in one room, and where we clarify where we have cross-cutting activities and how we can help each other and improve it. Now we are piloting national bridging workshops with focusing on rabies. So it was piloted this year in African continent. Maybe we can plan this next year in any other country. So just like to guide you a little bit, we changed our website. Now it's WOAH. So this is how you can find something about about PVS pathways. It's improving veterinary service. And then you come here and you will see PVS pathway. And there is special targeted support. You can find information on One Health. So I would like to say thank you, and again to repeat, like, it's a great pleasure for me to be part of this, and thank you so much for invitation. Thank you so much. I will stop sharing this thing.
Dear Valentyna, thank you so much for your presentation and for sharing of your experience and what are you doing now. It's a pleasure for us.
Thank you.
And join to our conference. Thanks a lot.